Hello, CJASON podcast listeners. My name is Mike Shlipak. I'm the Scientific Director of the Kidney Health Research Collaborative at the San Francisco VA and UC San Francisco. And today I'll be talking about our recent publication in CJASON entitled Urine Biomarkers of Kidney Injury and Declining Estimated GFR Following Tenofovir Initiation. This paper was co-led by Dr. Simon Asher, an assistant professor of medicine at UCLA. Many prescribed medications harm the kidneys, and physicians often wonder, how can I safely monitor my patient after starting a nephrotoxic medication? One promising approach is the use of novel kidney biomarkers. This is a relatively new research field that has the overarching goal of turning a urine specimen into a liquid biopsy of the kidney. A critical unanswered question is whether we can use these biomarkers to help monitor patients who are taking a nephrotoxic medication. We addressed this question by studying 198 HIV-infected men and women who started taking the medication Tenofovir, Disoproxil, Fumarate. Tenofovir is the most common antiretroviral used to treat HIV worldwide, but its main limitation is nephrotoxicity. Tenofovir damages the proximal tubules, and it may cause extensive injury and fibrosis before the blood creatinine becomes elevated. We measured 14 kidney biomarkers before and after each participant started tenofovir. From a baseline average estimated GFR of 103, tenofovir caused about a 10% decline in eGFR on average in the first year. We found that 6 of the 14 biomarkers in our panel were independently useful for predicting changes in kidney function, and they all localized to the proximal tubule or the loop of Henle, which reflects tenofovir's known mechanism of injury. These findings mean that a kidney biomarker panel could be useful to predict and monitor the kidney's response to tenofovir and potentially to prevent irreversible and devastating nephrotoxicity. Our research goals moving forward are to evaluate additional settings where medication toxicity is not adequately detected by the serum creatinine. And we hope to craft an ideal set of biomarkers to capture each medication's specific mechanism of kidney injury. Thank you very much for listening.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.